All right, welcome everyone. I'm Sophie Alexander from the Nutritional Wellness Center, and I'm really excited to have Robyn VanZeilen with me today from Dynamic Thermal Imaging. We're going to be talking all about thermography and what a powerful tool it is for monitoring your own health, particularly being proactive about your own breast health. So Robyn, I'm so excited to hear what you have to share with us today. Thank you for being with us.
Thank you.
Yeah.
My name is Robyn, and I'm the owner at Dynamic Thermal Imaging, and I'm a certified clinical thermographer. So we have been, though I guess I can get back into why we even started doing this. We do have a chiropractic background. My husband and I met at chiropractic school, and I actually did not finish because I decided, we wanted to have kids, and being a mom was kind of a priority for me at that time as I was getting older. But anyway, while I was at school, I learned about thermography and the benefits of thermography, especially when it's applied to breast health screening versus mammography. So that's kind of how I learned about it. And then, anyways, down the road, we had our kids. I was helping in the chiropractic office, and then realizing, all the women coming into our office, women's health and pediatrics was kind of the area which I was most involved with. And so we were recommending to all these women to go, for thermography scans, and they had to travel quite a distance. It was either out west, the California, maybe Colorado, even Toronto. We didn't have anything really locally. We did have one outfit that they would come like once, maybe every 4 months. So anyway, I kind of looked into it, and that's how I got involved with our thermography business, because I really think it is important that we do have this available to everyone around us. And now we just need to educate people on what a great tool it is. When we're talking about the body. So basically, thermography, it's a screening tool looking for early detection in any pain, pathology, injury, again, specific to breast pathology. The biggest concern with breast screening, everyone knows mammograms are kind of, the gold standard. That's what everyone gets, a mammogram for breast screening. But unfortunately, not everyone is aware that with mammograms, you are exposed to radiation and compression. Whereas thermography, it's completely non-invasive. So there is no radiation, no compression, and it is looking at the function and the physiology of our breast health. Whereas a mammogram is basically looking for structure. So they need to see a mass there. And quite often, by the time a mass is found, it's been there for 8 to 10 years. So, and if looking at thermography, again, we are looking at the health of our breast tissue. So we see these changes taking place within the breast tissue. And if we get it early enough, people can go to someone like yourselves at the Nutritional Wellness Center, and you guys can help them with lifestyle to reverse that so they don't end up with that mass, 5, 8 years down the road.
Right.
Yeah, so we have a little slideshow here because with thermography, I feel like the images really do speak volumes and might help you understand what it is we're doing and what we're looking at. So we'll kind of do a slideshow, and I'll talk a little bit as we go. So here's our little man here with our thermography colors. And the way the colors actually work, the colors are representing different temperatures. The warmest temperatures are white, and the coldest is black. So as you can see on this little body here, we have white, then it goes red, orange, yellow is kind of in the middle. And then as you're cooling off, it's green, blue, and black is the coldest. And again, I'll explain that further when we look at some other images. Let's see. And so again, our goal is just trying to empower you to make educated health decisions. Whatever you decide to do with your health is up to you, but we just want to give you the options and educate. So when you do make that decision, you do feel better about it yourself. And referring to people like you at the Nutritional Wellness Center is something that we try to do. And again, we can talk about thermography. So many people think they haven't heard of it because it is a new technology. We're actually, as you can see here, the first thermal imaging was actually recorded in 1948. I mean, it's very different than what we see with our imaging now, but in 1948 is when they were kind of thinking about this concept and how it could help, health wise. And then it was actually further developed and evolved with our military when they would use it at nighttime. They would use the cameras to look at their enemy approaching. They would be able to look at the heat pattern and that type of thing. So between this and the military, we kind of came up with our images that we see today. And again, the thought process for thermography goes back to Hippocrates. So in 400 BC, what he would actually do when someone would come to him with some kind of sickness, the first thing he would do is cover their entire body with a thin layer of mud. And wherever the mud would first dry, that's where he would first look for a disease, which is pretty cool because that's the disease process. And that's kind of thermography. That's what we have a camera to do it. We don't have to cover you in the mud, but yeah, so it kind of goes back all the way to the thought process from Hippocrates, which is cool.
Mm-hmm.
And then there are some other, kind of terminology that is kind of the same. I just wanted to make sure everyone is clear. So there's digital infrared thermal imaging, it can be used as thermology, which is the study of thermography. Thermal imaging are the images, thermograms are the images again. So all of these things are referring to thermography. And then, okay, we talk about the colors here. So there's a different range of colors, like I mentioned, white, which is the warmest, all the way to black. So the white and red would be the more inflamed areas, and the dark blue and the black, are the cooler areas where there could also mean there's some type of, disease process going on as well. And again, when I get the images up, you'll understand further. So here we're going to just kind of look at the breast specifically, the different options we have for imaging available. So we have mammograms, ultrasounds, MRIs, and obviously thermograms. So mammograms, again, it's ionizing radiation, and we know that accumulation of ionizing radiation is actually the main cause of breast cancer itself. With the mammogram, there's the compression, which again, is not great if there is an actual mass there already. And a mammogram is good for fatty breast tissues. So that's one positive for the mammograms there. Ultrasounds, they're non-invasive as well. They can tell the difference between if it's fluid filled or solid, which sometimes, that's a good option as well. What we do recommend, because thermography, since it is a test of function and physiology, we don't look at the structure. So we quite often recommend women to have an ultrasound done maybe every 3 to 5 years, because then that way you're getting the test of structure done as well as the physiology, which we are looking at. So you're covering it completely. So those two work really well together. And then there's MRIs, which are extremely expensive and very hard to get, but that's, depending on the situation, sometimes that's recommended as well. Let's see. So again, more specific about thermography here. Thermography, like I said, it's 100% safe. It's painless, non-invasive. It's definitely proactive. It can monitor your breast health over time, which is very important because we all know, our hormones really dictate a lot of our health. Especially as we get older, and there is going to be hormone fluctuation, and breast tissue does change and evolve. So we can actually look at that. We can see fibrocystic breast health, depending on the pattern of the disease or the breast thermograms. We can actually see if there might be a hormone imbalance. So these are all things that are important for us to be looking at, as we age. And again, with thermography, we do not see structure. That's the only thing. We do not see mass, whereas, the ultrasounds, mammograms, they can see mass. Let's see here. So again, yeah, thermography, it has been FDA approved since 1983, actually, which people are unaware of. And not only is it used for breast health, but like it says here, we can look for diabetes, heart, lung problems. A lot of digestive issues do come up. thyroid issues, what else? Back injuries, arthritis, headaches, fibromyalgia, a lot of dental issues do pop up, vascular disease, anywhere of inflammation obviously kind of pops up. And at that point, you can, kind of go to your practitioner and maybe you can pinpoint an area where it seems to be starting from, and then it might help them better, treat whatever health issues you're dealing with. And this is just kind of what it looks like, what you would expect. So as you see here, this is the camera, taking the images, and then our computer screen is where we see the images themselves. So what we do at Dynamic Thermal Imaging, like I said, we're just basically a clinician. So you'll meet with me, we take a detailed health history. I take the images, and then I submit all of that to a group of medical doctors who are board certified thermologists. They do the interpretation. So they do that interpretation and then they send it back to me. And then we will give you a call and kind of review with you, what the results are and kind of what you can do from there. So we don't do it all ourselves. Like I said, it's medical doctors that are doing the interpretation, which is nice as well. And again, we can do people of all ages because it is non-invasive. I know a friend of mine who's a chiropractor, her daughter, just as she was approaching, she's probably like 15, maybe, she found like a little lump, and, she came in and we did a scan, and, it was just normal tissue, but again, there was no worries that, she was getting any type of radiation or compression, and we all kind of felt comfortable. And then, the young girl, she felt comfortable too, because really we're not looking at you like this image here. This is just to kind of help you out. So she, no one's touching her, no one's looking at her. So she felt comfortable as well, which is nice. Let's see what else we have here. So this chart here kind of speaks volumes to me anyway. So obviously we know the slogan, early detection is best, which it is, because the earlier detected, the best probable outcome with doing things naturally. So if we look here, it explains how active cancer cells, they double, 90 days, 2 cells, a year, 16 cells. Well, if you're using a mammogram and you go down to the bottom of the chart, 8 years after it's doubled 32 times is kind of the average when a mammogram would pick something up. And at the 2-year mark right here at 256 cells, this is when thermography would notice some abnormal activity. So just this chart, again, you can tell, at that point, lifestyle changes, just your diet, adding supplements, maybe proper rest, exercise, you can reverse it. And we've seen it done several times. So this is why it is important to understand thermography. And once you do start, be doing these annually. And again, it has to be done annually because we need to keep an eye on your breast health, looking for any change, because everyone's different. Everyone doesn't have the same thermogram. We all don't have the same fingerprint. We have to find out what is normal for you and compare it to you each year. And we're looking at the change, because really after age around 28, outside of nursing and pregnancy, our breast thermography should remain stable and there should not be any change. And if there is change, we need to figure out why. Is it hormone imbalance, fibrocystic activity, cystic? What is it? And then we need to get it back to normal. So, and again, we're just showing here, how, I guess, when you're younger, things grow quicker. So this kind of shows you under age 50, average tumor doubling time is 80 days. And then between the ages 50 to 70, it's 157. And then as we get older, over 70 years old, the average tumor doubling time is 188 days. So basically, the younger you are, the quicker the tumors will grow. And again, that's why early detection is important. And this kind of just explains, down to more of the physiology, kind of what thermography, is looking at, and the inflammation. If there's an area of warmth in your body, it's trying to release the heat, those everything's open up, so that's why it gets warmer. And then with some pathologies, you're trying to keep the heat in, and those sphincters close and you're keeping it cooler. So that's when we see the areas of coolness. And again, depending on the pattern of the hot or the cool, that can let us know the type of pathology we're dealing with. So this is, again, we're just going to go through some images here. So, these are some sinus issues that have come up just because of the pattern that the doctors have seen here. Oral pathology comes up quite often, lymphatic congestion. And that's kind of a big thing. I feel like we're just, touching the surface on lymphatic congestion in healthcare, but it is so important because obviously everyone knows, our lymph system removes all the toxins, but there is really no way to actually evaluate or monitor the lymph congestion. But thermography, because it is a test of function or physiology, we do see that lymphatic congestion. So at that point, we would refer you to someone who can help you deal with that, your lymph system to get that moving. Sinus headaches are things that often come up. And as you can see, there's different patterns here that indicate different symptoms and the different types of sinus headaches. And again, the doctors explain that within the report. Allergies, periodontal disease, oral pathologies are huge. Those come up quite often when you're doing the full body scans. The carotid arteries here, we can get a good look at that. And then heart, again, because the pattern with heart issues, depending on the pattern or what we see, sometimes the doctor might recommend you get that checked out. Because the first symptom of a heart attack or heart disease really kind of that you feel is a heart attack. So you want to get a hold of that beforehand. So sometimes we can pick up something like that. And this is looking at back pain specifically, where the white is, again, that is likely where it's the most painful, where there's the most inflammation. That might be able to help, your practitioner help you better deal with those issues when they see these images. And then the diverticulitis in this patient here, kidney over here. Thyroid issues do come up quite often as well. And then again, talking about pattern, basically, everywhere on our body, it should be within a certain temperature. And as soon as, we're outside of that normal temperature, the doctors are looking for specific patterns. So certain patterns with temperature indicate disease or pathology. So here we're looking at, the T2 spinal segment, this circular area of hypothermia represented by the blue, which is cooler. That is telling us that this person's immune system is chronically activated. And looking at their health history, you might be able to figure out why. So then doing our scans regularly, again, might help monitor kind of how, how they're coming along with their practitioner's help. Myofascial inflammation is a big thing that comes up all over the body. Again, the carotid arteries here. And this was a cooler hypothermia area, possible lung cancer here, fibromyalgia again. And so you could see it, which is nice to see. There's really no other tool that can show trigger points for the fibromyalgia. And then early stage diabetes. Again, this is a pattern like I was telling you about. Certain patterns indicate certain things in this. And I can actually, this aren't the images, but my mother-in-law who came in and got a full body scan done, she actually came back with not as much, but her hands were warmer bilaterally. And so in her report, the doctors mentioned, pre-diabetic. And she's like, well, I'm totally fine because I just went to my doctor and I got all that test done, and I'm fine. There's no diabetes. And sure enough, 5 years later, she was diagnosed with diabetes. And so, at that point, she started to change her lifestyle. But, 5 years earlier, when she did have her scan done with us, if she would have only kind of took it a little more serious and started to make little lifestyle changes, then it might not have got to that point. But for some people, that's what it takes, unfortunately. And then again, these are just kind of myofascial things here, stress fractures. And then here we'll get a little more specific, talking about breast thermography. And again, yeah, it takes probably like, to take the images themselves only takes a few minutes. The longer part is spent with your health history, because we just want to make sure we have that down in detail properly. But this image here is showing us, kind of good symmetry. So basically, our breast tissue is more an extension of our body, so it should be cooler than our core, and the cooler areas are represented by blue. So you see the breast tissue here, they're blue, and they're pretty much symmetrical from side to side, not exact, which they don't have to be, but you want them similar from side to side. And the warmer areas, again, are expected to be under your arms, around the neck, under your breast tissue. We're always warmer there. So again, those areas are represented by, like maybe some white, red, or orange, which again is normal. So this is a normal thermogram here. And then these are all the image that we take. So we take an anterior view, we take two lateral views on both sides, and then we take the oblique views as well. And we also take an image of the back. So this is kind of another, this is a case study where they did use thermography, which is kind of nice to see these images. So the way thermography works, you'll come in and we do your first scan, and then 3 months later, it is protocol for you to come back and do it again, because basically we need to compare to make sure your breast tissue has not changed, because again, outside of nursing or pregnancy, your breast tissue should be stable. And really, we choose 3 months because it takes at least 3 months for the body to change at the cellular level. So 3 months is kind of as early as we could get. And if there is something going on, we don't really want to go any longer than 3 months, because we want to catch it, as early as we can. So with this example here, this is her first baseline scan. And as you can see, it's not totally symmetrical. There's a little warmer up here than there is on the left side. So then 3 months, she's asked to come back. And as you can see here, it has evolved a little more orange here. And this side is looking the same. So that would be suspicious. So at this point, our doctor said, you probably should get that, checked up further, because, it has evolved slightly. So she did get a mammogram at this point, but the mammogram was inconclusive, because again, there would be no mass yet. So from here, at this 3 month time frame, she was told to come back in a year for a mammogram. But she did follow the thermography schedule, which we asked to come back in another 3 months, because we couldn't call this a stable baseline because it had evolved. So 6 months later, this is how it has evolved to. And then again, she came back at the 9 month time frame, and then 12 months. And at this point, she went in and asked, for her mammogram to be done earlier than what they originally had told her. And sure enough, she was, they did find a calcification, and they did a lumpectomy, and then she's had stable thermograms ever since they did that lumpectomy. So again, as you can see, with these images here, the importance of thermography, incorporated, as well as if you want to do mammograms also, but it did get it a little earlier. So again, the most non-invasive, I guess, well, she chose to have the little lumpectomy, but again, that really isn't as invasive as getting a larger procedure done. So thermography was very helpful for this person here. Let's see. So again, this is kind of just showing you different thermograms and what they look like. So if you remember the initial thermogram I showed you for the breast area, which had, it was kind of all blue around the breast tissue and just warmer where you would expect to be warm. This here is showing DCIS and what it looks like. So this would be the tumor here, the cooler area, and then this white and red around, that's the angiogenesis. So that's basically, feeding the tumor the nutrients to make that tumor grow. And then you look over here for fibrocystic changes, and fibrocystic activity is very common, again, as we're kind of premenopausal and menopausal, but there are so many things we can do to reverse that fibrocystic activity. And again, meeting with practitioners, they can help you through with that. So something we definitely recommend is frankincense. It's always great, but again, your practitioners can work with you to kind of go over that. Let's see. So, and then again, inflammatory breast disease, because that is not a structural disease, it is, physiological. So if this person here went in for a mammogram, this would not even show up. It would be painful, but there would be no actual abnormal mass there. But with thermography, obviously looking at the right side to the left, you can see there's something going on, and this is inflammatory breast disease. And then again, we can't forget that 1% of all breast cancer is actually found in men. And this is an example right here, because we know men, if they feel a lump or something, they might not even think breast, disease or anything, because they're not a female, but it's something we need to be aware of with males as well. And this just kind of goes into angiogenesis and how it forms and how it's developed and how it destroys our DNA. And then this, some images, again, what the angiogenesis kind of looks like. So if you read this here, so in 2005, this person was diagnosed with a potential malignancy. A needle biopsy was performed. The results were negative. The reason was this is a preclinical condition with no mass. So again, her thermogram, something was noted, but then when they did the needle biopsy, there was nothing, no mass to be detected. Because probably on a mammogram, it would take 5 years. But, because of the thermography, we did have that early detection, and, the process was reversed just through lifestyle changes, thankfully. And it did inhibit that angiogenesis. And then she, has had, again, good thermograms ever since. And again, some people do, they have already been diagnosed with breast cancer. So they use thermography as a way to monitor the treatment instead of going in every 3 months for mammograms to monitor the treatment. Because again, we know the mammograms, it's ionizing radiation, which does attribute to breast cancer. So, but some people think that is the only way to monitor, the treatment plan. But again, thermography can be used. So this is someone that did use thermography to monitor the treatment. And then again, this patient has 2-centimeter ductal carcinoma. I think we showed this image before. And then here it is just on a grayscale image, which the doctors kind of can use as well. And then that's kind of it really, with the images that I wanted to show you. But again, at your appointment, going over a detailed history is important. Taking these images, coming back for that 3-month follow-up, because we want to make sure we get a stable baseline. And then at that point, if you are choosing thermography to use to monitor your breast health, it really is very important to come in annually, because we are monitoring the health of your breast tissue, and things can change in 2 years time quickly, and we might miss that. That's why we need to be kind of doing it annually. So Yeah.
Wonderful. Oh gosh, thank you, Robyn. This is really helpful. How do people find you? Right? Like,
So yeah,
what's the next step?
so basically you can go to our website, which is www.nydti.com, as in New York Dynamic Thermal Imaging.com. We have a lot of information on there, and then you can call us as well. If we don't answer, there's only right now we only have three of us, so we're kind of busy, and I have a 1-year-old, so um, we if you just leave a message and we'll definitely get back to you, basically.
Correct. Yeah, wonderful. And is my understanding correct that your base is in Rochester?
Oh
Is
yeah,
that
so
true?
yeah, our
Yeah.
home, yeah, sorry, I should have explained that. Our home office is in Rochester, but the equipment is mobile. So we travel, all throughout upstate New York, northern Pennsylvania, like we do go to Ithaca. We hit those locations that we travel to typically once every 3 months to make it, because people need those 3-month follow-up appointments. So yeah, we definitely travel quite a bit, and the schedule changes. So all that information is on our website as well.
Okay,
Yeah.
wonderful. Great.
Yeah.
Yeah, it's a powerful tool. I have had uh, not any clients have any issues come up with their breast health, though most clients have used it to monitor that. So thankfully, they're just using it as establishing their baseline.
Yes.
But I have had some interesting things come up with gallbladder or the colon, or as you mentioned, dental.
Yeah.
And so it's been a powerful tool for us to then explore further and be like, okay, like
Yeah.
what is the underlying cause driving, driving these imbalances in the
Right.
body?
Yeah. Yeah. No, it really is such a great tool, when it's used properly, and especially if you have a practitioner who is willing to look at it and work with you, that's huge. And I think we're moving more and more that direction. Like we get referrals every year. I'd say there's more and more practitioners, a different type of doctors referring, thermography, which is great.
Great. Yeah. And my client's experience has been very convenient too, right? They've caught you when you're in Ithaca and caught that
Yeah,
rotation. So
that's
I've
great.
rarely had anybody, make a special trip to Rochester or anything like that. And it's worked smoothly for them. So
That's great.
yeah, I thank you so much for just taking the time today and go through it. Those images spoke volumes,
Yeah, well, thank you very
and
much
I
for
think
having
it's
me.
really powerful.
Yeah, I think it's
And
it's
yeah,
it's unfortunately that in our society, we're very good at telling everyone you need to, think about heart health, dental health, spinal health, your eyes, but we don't specifically talk to women about breast health. Like we need to be talking to our young girls, before they hit puberty, about breast health and the importance of all these little things. So this is something that, we can try to educate our young girls on so they can use it lifelong, and maybe mammograms once in a while, but not the be all end all, just because we do know, the mammograms can cause breast cancer, unfortunately.
yeah. Yep. And I don't think many people realize that. It's just expressed as just the norm of what you start doing and what you
Right.
start monitoring now, recommended age 40 onward. And so I think it's powerful for people to know that they have another option, as a complete alternative or as a way to, space those mammograms further out
Right.
too.
Exactly.
Yeah.
Yeah.
All right. Thank you. I'm
Yes.
excited
Thank you
to
for
share this
having
with
me.
everyone. Yeah, absolutely.
Okay.
And I'm just going to stop the recording now.
Okay.